It's a jarring frustration. You leave cataract surgery seeing perfectly across the room, only to realize the text on your phone is a complete blur. If you were previously nearsighted and used to reading without glasses, this sudden loss of near vision can be a massive shock. The reason for this shift is purely mechanical. Your eye has lost its natural accommodation. Accommodation is your natural lens's ability to change shape and shift focus. During surgery, that flexible lens is removed. It's replaced by a monofocal intraocular lens, a rigid piece of plastic designed to focus light at exactly one distance, meaning your focus is now locked. Getting your near vision back is possible, but it requires a choice. You have to decide how much medical risk you are willing to accept to regain that close-up clarity. The blur you see when looking at a menu is the guaranteed mechanical outcome of standard cataract surgery. It is a result of the physics of the lens, rather than a mistake by your surgeon. Before you pursue any treatment, your first step must be a doctor's visit to check for PCO, or posterior capsular opacity. This is a common condition where the thin membrane sitting behind your new lens implant becomes cloudy over time. If PCO is present, you have to delay any other fixes. You'll first need a simple laser procedure to clear that membrane and restore your baseline clarity. Attempting to fix your near vision while you have active PCO is useless. It is like trying to buy a more expensive camera sensor when the lens itself is just covered in dirt. We can evaluate your options for fixing this by plotting them on a map, weighing the medical risk level against how easily the treatment can be reversed. At the top of the risk scale is an IOL exchange, reopening the eye to physically swap out your lens implant for a different model. Reopening a healed eye carries severe risks, including damage to the lens capsule, chronic inflammation, and the potential for permanent vision loss. A similar high-risk option is piggybacking, which involves stacking a second artificial lens on top of the one you already have. While this avoids removing the original lens, it still introduces risks like increased eye pressure and negative interactions between the two lenses that can degrade your visual quality. Internal eye surgeries offer a poor return on investment for your safety. They are reserved for extreme medical necessity and are rarely appropriate for basic reading convenience. Most patients find a better balance by looking at external solutions, beginning with the safest possible option, reading glasses. These can be customized for your specific routine, such as using an intermediate prescription on top for computer work and a stronger prescription on the bottom for reading. On our matrix, reading glasses sit in the ideal corner. They carry zero medical risk and are fully reversible the moment you take them off. They are the pragmatic standard. They provide immediate results without a single surgical risk, though you must accept the physical daily nuisance of carrying and swapping them. For those who refuse to wear glasses, there is a highly effective middle ground that many patients never consider: multifocal contact lenses. These lenses sit on the surface of the eye and create multiple focal points simultaneously, allowing you to see both distance and near clearly. This plots right next to glasses on our matrix because it is non-invasive and completely reversible if you decide you don't like the experience. The trade-offs are lifestyle-based. You need the dexterity to insert them daily, a commitment to strict hygiene, and an acceptance that you may see a slight drop in visual contrast in low light. Multifocal contacts serve as a practical trial for life without glasses, allowing you to test the experience before making any permanent commitment to a medical procedure. The final permanent option is laser vision correction, such as LASIK or PRK. This involves a strategy called Monovision. A laser reshapes the cornea of one eye for near vision, while leaving the other eye set for distance. This moves us into the permanent quadrant of our matrix. While the medical risk to the eye's interior is low, the change to the cornea cannot be easily undone. This requires a compromise. You sacrifice perfect binocular distant sharpness. Your brain also requires time to adjust to your eyes, providing two different types of visual data. Laser monovision is a permanent compromise. It provides freedom from physical accessories, but changes the way your eyes work together. Choosing the right solution means matching these three viable options to your personal lifestyle and your tolerance for risk. This scorecard helps categorize which path fits your specific needs. If you are risk-averse or do heavy computer work, you are a pragmatist. Custom reading glasses are your best fit. You accept the physical inconvenience for the sake of total safety. If you want to avoid glasses but aren't ready for surgery, you are glasses averse. Multifocal contacts are your best fit, provided you can manage the daily hygiene routine. If you want a maintenance-free life, you are an optimizer. Laser monovision is your path, as long as you can accept the loss of binocular distant sharpness. The most important takeaway for post-cataract vision is clear. Avoid risking the internal health of your eye by reopening it just to eliminate reading glasses. Select an external compromise that fits your life. None of these options should be chosen in isolation. They must be evaluated and cleared by a medical professional. Schedule a consultation with your eye doctor to ensure your corneal health and baseline prescription allow for the lifestyle solution you prefer.